Hi guys, I'm Margie. This is Dan.
Howdy.
We're the Gen-Xers, and we're going to be talking to you today because United Healthcare is back in the news, Dan.
Yeah, unfortunately.
I got a phone call into the operating room saying that United Healthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery.
A couple weeks ago, a doctor named Dr. Elizabeth Potter was interrupted during surgery by a United Healthcare representative, according to Dr. Potter, who asked her if this surgery that she was actively in the middle of was medically necessary.
It's crazy.
And she said, yeah.
It's like, do you understand that she's asleep right now? And she has breast cancer?
And then she posted her reaction to this call that interrupted her very important work. And that post went viral. And now apparently United Healthcare is suing her amongst other regular people that are out there posting negative things about United Healthcare.
Like Rocky once said in the Rocky that never really happened.
Sue me for what?
According to Rolling Stone magazine, they have hired the firm called Claire Locke, who is famous for taking on Fox News for the Dominion voting system.
Yeah.
And they won Dominion voting system close to $800 million from Fox News for Fox News's defamation of them during the election. And that is the company that's coming after you and me, Dan.
Yeah, they're coming after anybody that posts their experience with United Healthcare, which is almost always bad. And so if you post something bad about them, maybe you'll get a phone call. I don't know how out of control it is. But when we first started this channel, we posted several videos about United Healthcare. And it's not just them. Let's get this straight. It's the healthcare system in the United States, period. And they try to make this political thing, but it's not. People, no matter how conservative they are or no matter how liberal they are, all agree that the healthcare system sucks and something's got to happen, right? But anyway, when I first came down with the RA, it came on fast and hard. I was in a wheelchair. If I had to go too far, walker, or at least a cane otherwise. And then I got a few meds that helped a little bit, but not as much as we would like. I mean, it still made work hard. Makes doing this channel hard. Anyone who's been here long enough knows that we've sometimes went weeks to even a couple months without posting because I've been in too bad of a flare-up to really do it. But anyway, my doctor decided he wanted to try Humira. And he would have tried it even earlier, but he already knew that unless he tried a bunch of other stuff first, that United Healthcare would not pay for it. So it took forever for them to approve the Humira, and when it didn't do jack crap. So buddy, you better believe I was kind of scared then about what would happen. But they did, to their credit, approve Rinvoq next. And even though it took probably a little bit longer than it should have. But anyway, it worked pretty good for a while. It worked really good. My symptoms were almost gone, and then they came back, which sometimes happens with these biologics. Autoimmune problems are really complex. It's not a one-size-fits-all solution for anyone when it comes to what kind of medication is actually going to be effective. So there's a lot of testing things out to see. But United Healthcare doesn't seem to understand that, I guess. And so it's been over 6 months now that I've been without any kind of biologic or a med like that. And so I'm working from home mostly, tired all the time, brain foggy. Also, like Rocky once said, my brain don't work too good no more.
My brain don't work too good no more, Adrian.
Yeah, it's a mess. So they're all up in arms about people talking smack about them. Well, help people out. Like, I pay a ton of money every month through my work, whatever, they take it out of my check, for this insurance. I mean, a lot. And even when they do pay for some of the stuff, it doesn't seem like much. Like, my rheumatologist bills still come in with enough money that they're piling up in there, believe you me.
Well, it seems to me, and, you know, it seems to me that the companies are paying less. Not, like you said, not necessarily United Healthcare. All of the insurance companies are paying less, and they're categorizing and specializing more so that you have to jump through more hoops in order to get coverage. And they're even doing the accessories sold separately sales model now, where sure, you can buy, let's talk about a home insurance. If we're talking about insurance too, You can buy home insurance, that's fine. But the flood insurance is going to be separate. The fire insurance is going to be separate if you live in California. Those are things that used to be covered under the whole umbrella, if you will, of insurance. That's what it was for when disaster struck. And now, because they're not making oodles of money hand over fist whenever they cover those things, now things are off the table. You're going to have to take care of those things yourself, or purchase this extra policy that used to be included.
I'm surprised they haven't done it with healthcare yet. Get your extra cancer or extra autoimmune disorder or extra mental health care separately. I mean, I know these medicines are expensive, and that's a whole different can of worms. I mean, these biologics are $5,000 to $10,000 a month if you have to pay for all of them yourself. So I do get that. But don't tell me they're not all in it together as well. The pharmacy companies and the insurance companies, right?
They both they
call me a Gen-Xer, but I'm too cynical to believe that.
They kind of all benefit from one another's existence, don't you think?
I believe so.
A little
yes.
bit.
And both of them's got the government in their back pockets. Don't matter who you vote for. So anyway, we're not afraid. We're not scared of United Healthcare.
I am.
I mean, what worse could they do than what they've already done in denying us our medicines and all other people, right? I don't know.
Right. Well, I was struck, the other night. I wanted to talk a little bit because we were watching NBA. We were watching basketball. And I was struck at the difference between my coverage with my medical insurance, my health insurance, with my maladies under insurance company shall not be named, and the comparison with NBA players' coverage. Now, they were talking about an active player, which makes a difference.
Sure.
I think.
Yeah.
I don't know how our retired friends at the NBA, what their health care is like. It should be excellent with all that they've given their teams and us fans. I don't know how that is. But I know this was an active player. And the coaches were talking about the multiple scans they would have to do to his injured oblique, which is a back muscle, per day. We're going to have to do multiple scans per day to make sure that injury heals correctly.
I guarantee they didn't have a United Healthcare.
Well, I'm sure, an oblique muscle injury. I've had symptoms that are similar for several months now. I have yet to get one scan. Do you know why, Dan?
Because we have the healthcare that you don't want to name?
Well, that, but also because I have that health care, because my couch sitting obliques are not nearly as as profitable, thank you, as NBA obliques.
Well, they're prettier.
Well, thanks. I appreciate that.
Yeah, it's just a mess. And like I said, I don't think this is a political thing at all. Everybody on both sides seems to have a horror story about healthcare, unless you're, independently wealthy or something, then maybe you don't. But something's got to change. My story with the RA is bad enough, I feel. I mean, here we are over 3 years later, and I'm still in pain all the time and having trouble getting medicine. But there are people getting turned down for life-saving cancer medications and things like that. I don't know. Share your story below. Let us know what you think. And thank you for watching.
Thanks, guys.